is. So in low middle income countries, there are high burdens of HIV, TB, and malaria for all kinds of reasons. They are a background disease, in some respects, but of course, if you're living in those countries, they are front and center of mind because they are the thing which, people are dying of. The trouble is that these health systems are doing a great job of providing these services, and they have plans to expand, and there are lots of ambitious plans about what can be done about these diseases. But the health system isn't running with lots of spare capacity. So when it's got to also find lots of beds and lots of doctors and nurses to respond to the COVID-19 epidemic, well, they have to come from somewhere, and they come from one of the other programs. There aren't, when you want to do diagnosis for COVID-19, you need to use machines. Those machines would normally be doing diagnostics for TB or HIV perhaps, and then they're repurposed for COVID-19 because there isn't the capacity to just have loads of machines spare the whole time. So it comes from the health systems of poor countries doing a good job in normal times, but not necessarily having the ability to take on new challenges. So that's why the issue is especially acute in low middle income settings, I think. For instance, with HIV, this idea is that there are a lot of people who are on medication, and they would normally be picking up this medication from a pharmacy every month. They'd be in a queue, and so, well, obviously, we don't want that to happen if there's a risk of transmission in a lockdown. So what do? Well, maybe when someone arrives, you give them not 1 month but 6 months worth of prescriptions, so they can not have to come back. Maybe we could arrange, and it is happening, that one person picks up prescription for a whole group of people. So you're minimising the risk that way. There are also community pharmacy lockers where medications are left somewhere peripheral away from the clinic, so you don't have to go there. So these kind of innovative things, are happening and are exactly what I think is required to keep the supplies going, even as the health system faces these challenges. But the same type of issue, of course, pervades. And if you're sitting here in the UK, there are all kinds of news stories saying, oh, but during the time of the lockdown, people weren't being diagnosed for conditions that they otherwise would have been, and that's going to have a consequence for them. So it's the same sort of issue in different places. We focused on these diseases because they're the ones which are most important in low middle income countries.